I have a couple of projects I'm working on, but one that I'm most excited about is understanding how law enforcement are increasingly leaning on healthcare providers to help them do their prosecutorial or investigative work. So that could involve taking confidential genetic samples from medical databases, or it could involve requiring patients report to their physicians things like sexual assaults as a prerequisite to the patient receiving care. I have a background in medical ethics, and as I started tracking these laws that were really blurring the lines between law enforcement and healthcare, I started to notice that what was going on is that the law enforcement officers are often relying on the goodwill of physicians to really shoehorn politics into the physician-patient relationship. So the police necessarily have to serve the whole public. So they're thinking much more in terms of utilitarian goals. They're not necessarily focusing on the rights of individuals. And that's kind of by design, given who they serve. Physicians, on the other hand, are meant to serve individuals. They're not looking to even serve the public health necessarily. It's really individual patients that are their primary concern. And so that's why there is such an emphasis on the autonomy of the patient, the privacy of the patient, making sure that there is trust and confidentiality. And so part of the problem here is that when law enforcement is relying on these ethical norms in medicine to really leverage the fact that physicians are already heavily regulated, then what's happening is these carceral ethics are really infecting the clinic in a way that will destroy patient trust in the healthcare system. So there are a lot of examples in the news lately of the police going to newborn screening databases to get access to genetic samples to prosecute crime, to requiring that physicians look at certain criminal databases before they prescribe medication, to making sure that physicians say things to patients that actually violate the physician's ethical norms. For example, making physicians tell people who would like to terminate their pregnancy that abortion causes cancer. That's completely not true. So what you have are physicians who are forced to either comply with their ethical norms or to potentially risk felony prosecution. And so risk-averse physicians are choosing to comply with the criminal law, but that means they're violating their own medical ethics norms. And then also, because physicians are pretty risk-averse as a population, we're already seeing impacts where there are medical deserts in the states that have tried to restrict gender-affirming care or have banned it or who have banned abortion. There are big regions of Idaho that have no OBGYN. And so there really is a direct impact between this carceral involvement in healthcare and physicians saying, I don't want anything to do with that, which really leaves patients without adequate healthcare. One of the trends that I'm watching in this area is the real community network that is developing in hospitals and in clinics around the country. I'm part of an organization called HELIP, which is Health Equity and Access for Law Enforcement Involved Patients. We're sharing hospital policies around when is it required to turn things over to the cops, when is it not, and it's discretionary. We're sharing policies around what are the rights of patients who are incarcerated when they come to the clinic. And so what I'm noticing are definitely some policies that are being enacted at the hospital level to try to push back against some of this encroachment by law enforcement. So I actually think there's something special about the physician-patient relationship. And even though it's really taken a hit in recent years, as physicians have been expected to see more and more patients and not really getting the time to get to know them, it's still something that is incredibly valuable to make sure that patients are getting good care. If patients don't trust their healthcare providers, they aren't going to share sensitive information with them that is critical for their healthcare. They may not get vaccines. There's data to suggest if they don't trust healthcare, they're less likely to get cancer screenings. So trust in healthcare is incredibly important and has even been identified as a social determinant of health. The problem is that there are groups of people who already really distrust physicians, and we need that to go in the other direction. So we need them to trust physicians more so that we can increase vaccine rates and to increase people's trust in the system. And involving the police in healthcare and allowing the police to have access to sensitive medical information, or even requiring that physicians report things to the police before they can treat their patients, this is only going to erode the physician-patient relationship even more, and is going to infect these kind of prosecutorial goals into what should be a very autonomous, trusting relationship.